Hi, good morning, everyone. Welcome to our Nutrients Essential for a Healthy Immune System. So this morning, we are very honored to have Dr. Neo to be sharing this segment with us. All right, so let me first begin by introducing our dear Dr. Neo. Next slide, please. All right, so Dr. Neo Wee Suan, all right, this is the man, all right. So he has actually graduated from NUS and he works in various public hospitals before coming out into private practice. And Dr. Neo is a firm believer of the preventive medications, all right. So he believes that everyone should be empowered with knowledge to take charge of your own health, all right. So without further ado, I'm going to pass the time over to Dr. Neo. Over to you, Dr. Neo.
All right, thank you very much, Felicia, for your kind introduction. Good morning, everyone, or good afternoon, Australia. The reason for us picking this topic is because, as you're aware, we are living in exceptional times right now there, all right? In case you've been hiding under a rock, you should know that we are in second year into the pandemic. In fact, almost 2 years have passed already there. I'm sure that I've received many questions regarding our immune health, really. So I decided to talk on this topic again, and I feel that a lot of people out there are still pretty unaware of certain things and what's important for their immune health there. All right. So let's continue. But before I do so, let me just say that all the slides that I'm about to show are just meant for educational purposes. Right. The products mentioned or anything else talked about is not meant to diagnose, treat, cure, or prevent any diseases there. All right. Okay. So our immune health is something that is really critical for our well-being there. All right. Especially in this current pandemic there. All right. It's absolutely crucial because it's the first line of defense against infection, against cancer. Right? If your immune system is unhealthy, then you will be at higher risk of getting infections, cancer, of autoimmune diseases there. Okay? So therefore, having a healthy immune system is absolutely critical. All right? It's vital. I cannot emphasize that enough there. Okay. Okay. So what are the signs that may indicate that you have got a weak immune system, okay, or even a dysfunctional immune system? Okay. Well, you're continually stressed. That's the first point. Why so? Well, unfortunately, when you're continuously stressed, I can tell you that your cortisol level in your body will be very high. Now, what's wrong with a high cortisol level in your body there? All right. So basically, well, when you have high cortisol level, the cortisol will suppress your immune system. Okay, take note that. That is why you often hear stories of people after they've gone through a prolonged period of extreme stress. All right, for example, death in the family, depression, whatever. All right, they become ill, seriously ill there. All right, like for example, cancer or get cancer or serious infection. Right now, the second sign that may indicate your immune health is not all that good is that you're not getting enough sunlight. Why sunlight? Well, sunlight is important for production of vitamin D, and vitamin D plays an absolutely critical role in our immune health. Well, you tire easily. Something's very wrong if you feel tired all the time, isn't it there? All right, your body is out of whack. All right, that means your system is also out of whack as well. Right. The fourth possible sign is you're always getting a cold. You're getting, chest infections, all right, or other kind of infections. For example, you get, say, shingles, for example, every now and then, all right, or get cold sores, all right. That's an indication that your immune health is not good. All right, you're overweight. Well, what's wrong with being overweight? Well, unfortunately, when you're overweight, your body is unfortunately have got a higher level of inflammation compared to other people there. All right. This is because the fat, the visceral fat, especially that's in your body, is not metabolically inert. It's metabolically active. It produces inflammatory chemicals there. All right. That cause chronic inflammation in your body there. Another sign that the immune system's not good is your wounds are slow to heal. All right. Okay, this is obvious. You often have tummy troubles. Why tummy troubles? Oh, well, basically, if you have got a bad gastrointestinal problem, bad gastrointestinal health, it will tell me that your function of the gastrointestinal tract is affected. Well, you're not able to absorb the necessary nutrients that your body needs. Right. On top of that, I will discuss later. Our gastrointestinal tract contains something like almost 70% of our lymphoid tissues there. Right. So ask yourself, do you have any of these signs? If you do, then I can tell you that you probably have got a weak immune system. Right. And another thing, okay, I wouldn't just say weak only there, all right? Other signs that may indicate that you've got dysfunctional immune system, which we'll talk about, is, for example, you've got autoimmune diseases there, all right? Your immune system is not regulated. Therefore, you can get autoimmune diseases like lupus, rheumatoid arthritis, eczema, and so on and so forth there, okay? All right, now I'm going to talk a bit about infections in elderly. Unfortunately, when elderly gets infection, they tend to fare off a lot worse than compared to someone who is younger. This is because of a phenomenon known as the immunosenescence there, all right? So basically, what immunosenescence is that it refers to the changes that happen due to our immune system, changes to the immune system as we age there. So what happens when we age? All right, basically our immune system will decline. All right, how does it decline? Basically, well, it reduces production of various kinds of cytokines, including the non-inflammatory cytokines there, right? Then there's also altered expression function of this TLR, which is the toll-like receptors, which are important for our innate immune system, then depressed T cell function, reduced function of B cells, which produce antibody. Okay, right. There's a lot of medical mumbo jumbo here. I get it. All right. So just to cut long story short, when an elderly when you go in an older age group, the immunosenescence is marked by these few characteristics. Well, the decline in function of our immune cells, lower antibody production, you also become more prone to chronic inflammation there. All right. So that is why for the elderly, for example, then, all right, because of the decline in function of the immune cells, they have high risk of infection, of high risk of cancer, and they may not respond so well to vaccination as well too. All right, especially say production of antibodies there to the current COVID vaccination there. All right, that's why the level of antibody tend to decline a lot faster than someone younger. Right. So I mentioned here the third point in immunosenescence is that they're more prone to chronic inflammation. There's a term that we use to this chronic inflammation when you are in the elderly group. It's called inflammaging there, all right? As you age, more inflammation, chronic inflammation. Now, this inflammation, all right, basically is progressive. It's chronic, long-term, all right? It tends to get worse. And it's sterile, meaning it's not due to bacterial infection, all right? It's low grade. It's in the background all the time there. It's not like a acute flare-up and all that there, all right? But it's there in the background, all right? And it gradually gets worse there. So this is what this term inflammaging means there, all right? So you got to be aware, all right? Immunosenescence, all right? And inflammaging, it all comes together, unfortunately, as we age. So what are some of the essential basic nutrients that's required for a healthy immune system? Well, we all know vitamins, isn't it not? Yeah, so what are they? The vitamins A, the Bs, all right, the B complex especially, all right, then the C, which everybody knows about, then there's the D as well too, and of course the E, all right? Now, then of course there's minerals, okay? It's not, a healthy immune system is not all about taking vitamins, it's about also minerals, okay? Like zinc, selenium, copper, and iron. Well, what do these vitamins and minerals do? Basically, well, they help in production of immune cells, the antibodies, the cytokines, right? Antioxidants as well. For example, B vitamins are absolutely vital, right? The second function of these nutrients is, well, it's required for proper functioning of the immune cells. It helps to modulate the immune cells, in particular, vitamin D there, all right, which I'm going to talk about. And there's also zinc as well too. Then these vitamins and minerals also act as cofactors for enzymatic reactions. For example, the selenium, all right? So if you cannot just afford to just simply take, well, vitamin C and C alone there if you want to have a healthy immune system. You need all different kinds of nutrients, right? And all these are basic essential nutrients there. So next question to ask yourself is, well, what are some of the factors which can deplete our body of these essential nutrients? You may be taking enough, but there are other factors which can deplete there, all right? Okay. Firstly, illnesses, for example, especially gastrointestinal tract illnesses like Crohn's, ulcerative colitis, or infection, or any other chronic inflammation of the gut there, right? So illnesses, when you have illness, well, your body requires more nutrients there, all right? Accepts more nutrients are in the body there to try to heal itself. And unfortunately, if you got gastrointestinal tract illness, then you will not be able to absorb, first of all, to digest the food that you take. You will not be able to absorb the nutrients from the food there, all right? And on top of that, when you've got inflammation of the gut, you tend to have a phenomenon, what we call leaky gut syndrome, all right? And this can in turn lead to autoimmune diseases there. So the second factor which can deplete your body of essential nutrients is the poor diet there, all right? Unfortunately, the poor diet seems to be the norm nowadays there, right? All you need to do is just see what the young people are eating nowadays. Well, most of them are taking fast food, processed foods, all right? And I can tell you all these kind of foods are actually very bad for our health. Firstly, they are devoid of important nutrients, which our body needs, okay? And secondly, they are filled with, well, chemicals, artificial ingredients there, sugars, carbs. All these will have a detrimental effect on our health, okay? So poor diet is definitely a huge factor here. Then stress. When you're under stress all the time, all right, you'll cause your body burn out, to use up a lot more nutrients there, all right? That's given there, see? Alcohol, unfortunately, plays what do you call it? It's actually a toxin to our body, especially to the liver, all right? So this can, firstly, alcohol can impair our gut health, therefore impairing digestion and absorption of nutrients. Alcohol can also affect our liver health, our ability to metabolize and to also produce various important substances for our immune health, all right? Alcohol, like I said, is a toxin itself too, all right? Now, caffeine, some of you may be scratching your head. Caffeine, what is this? I take 2, 3, 4 cups of coffee a day, all right? Surely it's not bad for me, all right? Well, unfortunately, excessive caffeine can be bad for you there. Why? Well, caffeine can impair the absorption of nutrients from the gut, all right? You take too much of that. And caffeine is a diuretic. It will make you pee a lot more. Unfortunately, when you pee a lot more, a lot of water-soluble nutrients, like water-soluble vitamins and minerals, like vitamins B's, okay, C's, your C, for example, can come out in your urine there, therefore depleting your body of these nutrients there. All right, another factor that can deplete your essential nutrients in your body will be the excessive carbs and sugars. Why? Good question. Well, when you take a lot of carbs and sugars, unfortunately, your body needs to metabolize these carbs and sugars. Carbs become sugars when digested, right, folks? In case you still don't know, well, the sugars need to be metabolized in your body. To metabolize the sugars, unfortunately, will require more enzymatic reactions. More enzymatic reactions requires more nutrients, more minerals, more vitamins. Well, okay, and of course, sugars and excessive amounts of carbs and sugars increase your oxidative stress in your body there, and therefore your body needs more nutrients to repair itself there. Okay. Now, the last factor I'm going to talk about that can deplete your body of essential nutrients will be medication. Unfortunately, too many of us take too much medication nowadays, and that's partly to be blamed on the doctors as well, I must say, all right? Now, some medications which can impair well, essential nutrients of body absorption, all right, will be diuretics and stomach acid blockers there. Diuretics basically, well, makes you pee a lot more, and out comes your water-soluble nutrients there, okay? Stomach acid blockers. Well, it seems that half the world is on this stuff, isn't it not, right? Basically, where these kind of medication, the stomach acid blockers, reduce the stomach acid. Yeah, what's so bad about that? Well, the unfortunate thing is this: stomach acid is absolutely critical for digestion of food, right? Yeah. Well, right. So stomach acid is required to digest the food so that we can break down food into the basic nutrient building blocks, and then absorption of these nutrients can happen. So if you are lacking in stomach acid, all right, especially for long-term stomach acid blockers, then unfortunately, you're going to get, indigestion most of the time, isn't it not? You will not be able to extract the nutrients from the food. And therefore, your body will not be able to get the necessary nutrients, even when you're eating healthily, so to speak there. All right. So that is why, all right, you should not be on stomach acid blockers for the long term there. Right. But unfortunately, right, too many patients is on this for the long term. Right. And it's definitely proven that if you're on long-term stomach acid blockers, you're high risk of getting deficiencies of what? Of magnesium, of B12, of calcium, all right, and other various vitamins as well too there, and minerals, okay, and including the iron, so on and so forth there, right? And then this will definitely have a cascading effect on your health down the road there. So be aware of such factors here, folks. All right, let's talk about vitamin C. Everybody knows about vitamin C, right? It's an antioxidant, all right? All right. And what most people don't know is that this is an essential micronutrient, an essential vitamin. Why do I mean when I say essential? Well, our body is not able to produce it. Therefore, we need it. So how are we going to get it? From our diet or from our supplements there, all right? That's the only way we can get vitamin C, all right? So therefore, we need to take vitamin C on a constant basis, preferably on even a daily basis there, all right? Because our body is not able to store vitamin C as well too, okay? So vitamin C needs to be taken on a regular daily basis if possible, if you want to have a good immune health there, okay? So vitamin C is known to enhance our immune system. It helps to stimulate production of leukocytes or white blood cells. It also enhances their function as well too. And vitamin C also increases complement proteins there, right? These complement proteins are basically laser pointers, all right? They stick to the pathogens like laser beam and guides the antibodies, all right, to attack the pathogens there, all right? So vitamin C, absolutely crucial. So take away here, the essential micronutrient. So regular vitamin C supplementation can actually reduce the occurrence of common colds in individuals, okay, especially if you are under high physical stress there, okay. It's been shown to help to reduce the duration of colds as well too. And studies have shown that high dose of intravenous vitamin C has been shown to help people with severe infections, including sepsis, right, the blood infections, right, they have, and also acute respiratory distress syndromes as well. So this is just one review article. All right, vitamin C as a treatment for sepsis. All right, so sepsis refers to severe infection, especially blood infection. All right, so it helps to reduce the oxidative stress and inflammation. It also helps to enhance the immune cell function there. Okay. All right, and role of vitamin C and immune function. So we see vitamin C helps contribute to immune defense by supporting cellular functions, all right, of both innate and adaptive immune system. All right, if you are deficient vitamin C, this will result in impaired immunity and higher susceptibility to infections, all right? And in turn, the bad news is this, all right, the infection will significantly impact on vitamin C level as well, all right, due to enhanced inflammation and metabolic requirements. So if you are already low deficient vitamin C, you're high risk of getting infection. And if you get an infection, all right, the infection will deplete your vitamin C even further there. That's the gist of it there, all right? So supplementation of vitamin C seems to prevent or reduce the risk of these respiratory and systemic infections and can also help to treat such infections as well. All right, gut health is also absolutely critical for our immune health there. all right? In case some of you don't know, all right? Everything starts from the gut. Our good health starts in the gut, right? Good health is paved by good gut health there. So this is because our gut houses something like 70% of immune cells. These immune cells are situated in the lymphoid tissue, right? Inside our gut, along the line of the gut, and also outside the gut as well too there, right? So our gut also houses the good bacteria flora, and these good bacteria flora, right, often referred to as probiotics, okay, right, are important because they help to educate our immune cells, educate our immune system, help so that it will respond in the correct manner there, all right, to have a balanced immune system, all right, it will, so that it will prevent abnormal response to various things. If our immune system is not educated at all, it can respond abnormally, okay, to things which you're not supposed to respond to. For example, to food, all right? You may have, it may cause bad allergy reactions to multiple things, for instance, there, all right? So that's why gut is absolutely crucial for important immune health for these two reasons. It houses 70% of immune cells. It contains a good bacterial flora there, all right? Okay, so to have good immune health, we need to have good gut health, all right, so that we can absorb the necessary nutrients as well too. Okay, all right, so what are some of the supplements which can help to promote good gut health? Well, aloe vera. Okay, aloe vera is absolutely wonderful for promotion of good gut health, can help to repair the epithelial lining of the gut there, all right? Okay. It also provides many important nutrients. In fact, there are more than 200 nutrients, right, in aloe vera there, right, including vitamins, minerals, and enzymes and other phytonutrients as well. The next supplement which helps our gut is probiotics there, right? It helps to top up the good bacterial flora in our gut there. Okay, unfortunately, when your diet is well, it's bad, right? Filled with all those processed foods or other inflammatory foods for that matter, well, your gut probiotics level will be diminished as well, especially so if you have been taken antibiotics in the past there, okay? Of course, antibiotics kill good and bad bacteria alike. They do not differentiate, unfortunately, there, all right? So you have been on antibiotics recently or in the past, and then subsequently your gut health deteriorates. Trust me, you should take aloe vera and also probiotics there, right? You really need to top up your good gut bacteria. Next supplement will be digestive enzymes, because digestive enzymes help to digest the food that you eat, breaking the food down into small nutrient blocks to enhance the absorption. Then, of course, there's the fiber, there's omega-3 fish oil. The omega-3 fish oil helps to reduce inflammation of gut. Omega-3 fish oil is also immune modulator, which I will talk about. Okay, so when we talk about a healthy immune system, people often think, oh, a healthy immune system is a strong immune system, all right? Yeah, well, you're not wrong. Yes, you need to have a strong immune system, but let me also tell you that a healthy immune system is also one which needs to be regulated. It needs to be functional, okay, as opposed to a weak, unregulated, and a dysfunctional immune system, right? Your immune system can be strong, but if it's unregulated, it can cause you problems, right? It can start, your immune system can start to go haywire and start to attack your own body tissues, all right? And result in inappropriate responses, for example, to foods, to medication, to vaccines as well to that, all right? So therefore, a regulated immune system is absolutely crucial so that we can have appropriate immune response there. Okay, on the other hand, if your immune system is unregulated, it will result in inappropriate immune response, resulting in excessive inflammation, and this can result in autoimmune inflammatory diseases or cytokine storm syndrome in infections like COVID there, all right? So do take note, folks, all right? Don't think a healthy immune system as strong or weak. Always ask yourself, is your immune system well-regulated or unregulated? Is it functional or dysfunctional there, all right? That is a lot more crucial there. All right, so let's talk a bit about COVID, all right, since we're in the midst of pandemic right now. We all know that COVID infections tend to start off mild, especially at the when we first started off in year 2020, right? In the first week, most of people who catch COVID are relatively stable. Then suddenly, after about 5 to 7 days, they start to deteriorate. All right, the lungs, they start to have respiratory distress. All right, the blood pressure, their breathing difficulty. All right, their blood pressure starts to drop, and then their organs may start to shut down. There, they may start to have blood clots all over their body, and any organ can be affected: the brain, their kidneys, intestines, whatnot. There, all right. Okay, so we all know that this is due to a hyperinflammatory response. There, all right. So this hyperinflammatory response is basically due to a phenomenon what we call cytokine storm. Right, and this cytokine storm is unfortunately induced by their own immune system. All right, so there you go, cytokine storm. Okay, can make the viral infection become deadly there. All right, so what happens in cytokine storm? In cytokine storm, there's basically an excessive immune response by your immune system, and all right, in response to this infection. So this excessive immune response or this hyperinflammatory response will then ravage your normal tissues, body tissues, like your lung tissue. Then this can lead to respiratory distress, or it affects other organs like kidneys, all right, or liver. It can lead to other organ failure as well. It affects your brain. It can lead to mental changes. It can lead to strokes. It affects your blood vessels. It can cause blood clots there. And these blood clots can travel all over the place. All right. So that is the main cause of the morbidity and mortality in this COVID infection. Right. And okay, so there it is. So coronavirus can attack the lining on the blood vessels. And unfortunately, when your immune system start to respond to this viral attack, all right, causing inflammation of the lining on the blood vessels. This can cause damage to the blood vessel lining, and hence blood clots will form, and these blood clots can travel anywhere, all right, throughout your body there. See, so that's why some people may have can have affected skin, all right, this blackness, you know, or darkening of the skin, all right. They have other organ failures, like the kidneys I mentioned. It can affect the brain. It can cause changes in your personality, reduce cognitive function as well too. So COVID is not something to be sneezed at there. All right, folks. It can cause other secondary issues through the cytokine storm as a result of hyperinflammation. All right. So in this cytokine storm and hyperinflammation can unfortunately affect the young middle-aged people. It's not just the elderly there, right? So that's why even people in the 30s and 40s are affected, all right? They get all kinds of complications, and they die from it there, right? And you can see from the internet that there's so many examples of similarly healthy people in the 30s, okay, fitness instructors even, all right? They die from after catching COVID there, all right? Okay. So therefore, what I really want to emphasize is that the healthy immune system is not only strong, but also regulated, right? Your immune system, when it's regulated, will respond appropriately without causing collateral damage to your body there, right? So this is very, very important there, because like I said, everyone seems to think about healthy immune system as a strong immune system. That's all wrong, all right? Yeah, they're not completely right there. It needs to be regulated. All right, so that is why, okay, let me just go back a little bit. That is why in treatments of COVID patients in the hospital, all right, we use medications to help to regulate, to modulate the immune system, all right, especially those in a high-risk group there, all right? We use what we call immune modulators there. Okay. All right. So, but those are actually synthetic stuff, synthetic drugs there. Okay. So, so basically, immune modulators, right, helps to modulate or regulate our immune system, preventing this hyperinflammatory response there. Okay, but guess what? There are natural immune modulators that exist in nature, all right, in the natural form. Okay, and these are some of those there, all right. And to me, the most important immune modulator, all right, is vitamin D. Because vitamin D is not a simple vitamin, right? It's actually a hormone there, all right? Vitamin D can actually help to regulate practically every function of our body there, all right? Okay, and vitamin D, there are vitamin receptors in practically every cell in our body there. Okay? We'll talk about vitamin D in a while. Right, so other immune modulators, curcumin, pycnogenol, astaxanthin, omega-3 fish oil, black cumin seed oil there, right? So all these are various natural substances which can help to modulate or regulate our immune system, right? Helping us to have a healthy immune system. Let's talk about vitamin D, the happy hormone, all right? Or the sunshine hormone there. Now we know for a long time that vitamin D actually plays an important role in modulation of immune system, right? Or to modulate the inflammation. All right, and it does so by regulating the production of inflammatory cytokines, all right, and inhibiting the proliferation of pro-inflammatory cells, all right. Okay, and both of these, the inflammatory cytokines and pro-inflammatory cells, are actually important in pathogenesis of inflammatory diseases there, all right. So studies have shown that a low level of vitamin D is associated with increased risk and unfavorable outcome of acute infections as well. So vitamin D deficiency is associated with inflammatory diseases, autoimmune diseases, all right, and of increased risk and severity of infections there. Okay, that's why it's saying here there. Okay, so moreover, okay, chronic inflammatory diseases like atherosclerosis, cardiovascular disease, in other words, asthma, inflammatory bowel diseases, and whatnot, okay, tend to have lower vitamin D levels as well, okay? And this low vitamin D level can actually plays a role in pathogenesis of such inflammatory chronic diseases. That's what it says here. All right, so regarding COVID, okay, vitamin D, right, is an important factor here, all right? Where at the start of the pandemic in 2020, okay, researchers make a strong observation there. What they found is that countries in the northern latitudes, right, north of this 35-degree north latitude, all right, have a very high, disproportionately high level of severe COVID infections and mortality, all right, from COVID there. Okay, whereas countries in the south part of this 35-degree north latitude, all right, have a lower level there. Okay, so countries in the north to this includes Spain and Italy there. All right, and guess what? Countries like this in the northern latitudes, like Italy and Spain, tends to have a lower level of vitamin D in the population. Okay, so there they go. Right, this is clearer here. There. All right, so they make this strong observation there. So mortality rates from COVID-19 are higher in these latitudes, these northern latitudes, with the exception of Nordic countries, okay, where vitamin D supplementation is widespread and deficiency is uncommon. All right, so and why is it so? Well, we know that vitamin D is important for regulation and suppression of inflammatory cytokine response there. All right, and this plays an important role in causing complications and severity of this COVID infection, isn't it not there? All right. So if the population is depleted, tends to be depleted vitamin D, they have a much higher mortality rate. Right? So it's no wonder at all there. All right. So I put out articles. So various prominent doctors have therefore come out to make statements about vitamin D, saying that vitamin plays a critical role in suppression of severe pro-inflammatory response, okay, which characterizes severe COVID complications. All right. So they also observe a high mortality rate from COVID infection in the nursing home as well. Why? Because those folks, inmates in the nursing homes are not getting enough vitamin D from sunshine or not getting enough from supplementation. Therefore, they're recommending, these folks to take vitamin D there, all right? So it seems that vitamin supplementation is the best means of ensuring sufficient vitamin D blood levels there, okay? All right. So this Harvard professor as well too has come out to make a strong statement as well too. All right, so it says that there's growing evidence that vitamin D status is relevant to the risk of developing severe COVID infection. Okay? Right, and she also says that vitamin D is absolutely crucial for our innate immunity and for boosting immune function against viral diseases there. And it's got an immune modulating effect and can lower inflammation and therefore reduce the risk of cytokine storm. All right, and there are various studies that's been done to show that if your vitamin D level is much lower, right, in the deficient, especially in the deficient range, you're high risk of getting severe diseases there. All right, this has been shown in multiple studies, right? Especially here, quoted here, observation studies from 3 South Asian hospitals. All right, so there are various studies. All right, so what they recommend, what some of these prominent doctors recommend, is that you should supplement, right? During this time, especially, you should take supplements there. Okay, so it's reasonable to take at least 1,000 to 2,000 IU a day there, right? And instead of 600 to 800 there, right? 600 to 800 to them is too low. And to me, all right, even 1,000 to 2,000 may be low, especially if you're potentially vitamin D deficient there. I'll explain in a moment there. Okay, so this is one article. Okay, again, reinforce the fact that if you've got vitamin D deficiency, you are much more likely to get severe complication, including death. All right, another article. Okay, the strong correlation between vitamin D deficiency and cytokine storm. All right, and also strong correlation between vitamin D deficiency and mortality. All right, okay. So, and they find, okay, well, you get the picture, right? Vitamin D deficiency, all right, is strongly associated with severe COVID infection and mortality, increased mortality. All right, so all those are observational studies, all right? All right, well, what about intervention studies? Because the intervention studies will prove that if you can supplement vitamin D and vitamin D helps to improve the outcome, then that will clinch the plot, isn't it not? Okay, and this is one study that's been published, which shows that if we add vitamin D to treatment of patients with COVID infection, it actually helps improve the outcome. This study was done in Spain. Yeah, all right. Okay, it was published in 2020. All right, so the result is this. All right, so basically, those COVID infected patients who were admitted to the hospital, they were divided in 2 groups. Both groups were given a standard treatment, but one group was given vitamin D, the 25-hydroxy calciferol, okay, all right, or the calcifediol there, right? So for the group that was given this vitamin D calcifediol, all right, out of the 50 patients, only one was admitted to ICU, or 2% of this population there, all right? Okay, now of the untreated those are untreated population, untreated vitamin D, all right, 13 or 50% had to go into ICU. That's huge there, all right? So completely disproportionate, all right? So, and of the group that was treated with vitamin D, none died. All were discharged without complications there. Of the population that was not given vitamin D, what happened? All right, okay. Of the 13 patients, the 13 patients were admitted to ICU for 50%. So 2 died, and the remaining was finally discharged. All right. So this study says it all, isn't it not? All right. So vitamin D, all right, significantly reduces the need for ICU treatment. It helps reduce the severity of the disease. That's what this study shows there. Okay. Now, a more recent study, okay, fresh from the oven, 3rd February 2022. All right. Basically, this is a study which compares people pre-COVID infection vitamin D levels. All right. So what they found is startling. If before you catch COVID, if your vitamin D level is low, all right, before catching COVID, if your vitamin D level is low, you are 14 times more likely to have severe or critical disease, or more likely to die from it as well too. That's what this particular study that was published, all right, just a week, more than a week ago, shows that, all right. So this study is really eye-opening there, right? You're 14 times, not 2 or 3 times, folks, 14 times, all right? If your vitamin D level is low before you catch COVID, all right? You're 14 times more likely to have severe disease from COVID. So let me emphasize again, therefore, vitamin D is absolutely critical there, right? If there's nothing else you take away from the talk today, please remember this, okay? All right, so what makes it hard to get enough vitamin D? Okay. Well, many factors, okay? Lack of exposure to sunlight, that is actually one big factor there, right? Unfortunately, in Singapore, all right, believe it or not, okay, although we live just by the equator, we get lots of sunshine, up to as high as 40% of the population is actually deficient in vitamin D. Not inadequate, not inadequate level, but deficient level, folks, okay? They've done studies to show that. Up to about 40%, okay, in sunny Singapore, it's actually deficient vitamin D. Why? Because most of us don't get enough exposure to sunlight, or rather most of us deliberately avoid exposure to sunlight. Even when you go out in the sun, you carry umbrella, you put on sunblock, sun cream there, all right? You walk along shaded areas there, all right? We avoid the sun like the plague there, all right? Why? Because especially ladies, we want to avoid photoaging, is that not? Okay. So we're covered from head to toe, right? So as such, we are not exposed to enough sunlight at all there. So lack exposure. So if you really want to be exposed to sunlight, folks, okay, ideally you should have 2/3 of your skin surface area exposed. You should be in shorts and t-shirts, all right? You should be out in the strong sun, right? Preferably something like 11 o'clock onwards, the kind of sun there. And you should be at least about 20 minutes in the sun several times a week there, all right? Only then will you get enough sunlight for your skin to make vitamin D there, all right? And sorry, folks, if you're telling me, oh, you get quite a bit of sun coming in through your windows at home, that doesn't count, because unfortunately, the glass will actually reflect the UVB rays, all right? It will prevent the UVB rays from coming in there. And it's the UVB rays, ultraviolet B rays, which will hit the skin and cause your skin to produce vitamin D. So you're not getting that at all there when you are sitting behind the glass panel, folks, okay? Right, no. So reduced skin synthesis of vitamin D, all right, is another problem. So if your skin health is bad, you've got chronic skin inflammation, say from eczema and whatnot, other inflammatory skin diseases, psoriasis and whatnot, then you're not going to produce enough vitamin D there, all right? Low dietary intake there, okay? So if you're not getting enough vitamin D-rich food, you're not going to get it at all there, right? So unfortunately, there are very few foods which are rich in vitamin D there, folks. I want you to take note of this there. There are very few foods. The only foods which are really rich in vitamin D are cod liver oil, which most people hate to take, and cold water oily fish, like your salmon, your mackerel, your sardines, all right? Those deep sea water fish, especially cold water fish, all right? There are others. There are vitamin D in other food sources like egg yolk, okay, in some mushrooms, all right, or fortified foods, but those are much lower, all right? So you're not getting enough sun, you're not getting enough vitamin D-rich foods, I can tell you, folks, you are definitely going to be vitamin D deficient, all right? Now, another factor is impaired intestinal absorption. You've got poor gut health, you've got gut inflammation, like Crohn's disease, ulcerative colitis, and whatnot. You're not going to absorb the nutrients like vitamin D, right? All right, or there's reduced conversion to active forms, or the vitamin D, say by the kidneys, okay, or even from the liver. Before vitamin D can be used by our body needs to be converted to the active form, first in the liver and then in the kidney there, all right? It needs to undergo hydroxylation process in the liver and kidney. So you have got liver disease, you've got kidney diseases like end-stage kidney failure and all that. Sorry, you know, don't get enough active vitamin D there, all right? Aging is an effect. As you age, the level of vitamin D tends to decline. This is because we have reduced production in the skin, all right? Okay. And secondly, a gut absorption maybe of vitamin D and other nutrients may be impaired as well. And our ability to convert the vitamin D to the active forms can be impaired as well because of impaired organ function like the liver and kidneys. Okay. So for all these various reasons, right, we may not be getting enough vitamin D there, right? Oh, and I forgot to mention for the skin exposure part, if you're dark skin folks, okay, that means you got a lot of melanin, all right, okay, then you will require much longer time of exposure to sunlight before you can get enough sun UVB rays to make vitamin D in your skin because of the protective effect of this skin pigment melanin there, all right? So folks gotta be careful there, all right, if you're dark skin, all right? So yeah, this is confirmed because those dark-skinned people has been shown to have higher risk of vitamin D deficiency. In fact, it's been shown that the dark-skinned population in the US, for example, right, the blacks and the Hispanics, they have a much higher risk of vitamin D deficiency. They have a much higher mortality from COVID infections as well too. Okay. So take note, vitamin D is absolutely critical for a healthy immune system. Just for information, every immune cell has got a vitamin D receptor. Wow, that tells you something, isn't it? All right, okay. So vitamin D helps to optimize and regulates the function of immune cells there, all right? Vitamin D helps to modulate, regulate inflammation there, all right? So vitamin D deficiency is very common, right? Even common in sunny Singapore, like I said, all right? Okay. So vitamin D deficiency greatly increases the risk of severe COVID-19 infection, right? I'm not going to say any more that vitamin D deficiency is strongly associated with severe COVID infection. I'm going to say outright right now that increases the risk of severe COVID infection. To me, this is a no-brainer already. You don't need any more studies. Don't need or any more studies to show this link at all there. All right, there's an absolutely strong correlation and there's a definite causal relation there. Okay, let me talk about the second immune modulator, natural immune modulator, and that's curcumin. So what's curcumin? Curcumin is basically the active ingredient that's extracted from turmeric. What's turmeric? Well, turmeric is what you know as the curry powder, right? So basically, curcumin has been used in treatment in Chinese and Ayurvedic medicines for a long time already there, all right? Dating back thousands of years there. And curcumin is a powerful antioxidant there, right? It can help to moderate an immune inflammatory response in our body, right? And many studies have shown actually that curcumin can modulate our immune system and reduce inflammation. And it's great for our overall health, including cognitive health, cardiovascular health as well too. All right, and for those with autoimmune diseases there. All right, so how does curcumin modulate inflammation, right? So basically, curcumin can block this cytokine release, the pro-inflammatory cytokines there, all right? So there are many of these pro-inflammatory cytokines, the interleukin-1, B, all right, tumor necrosis alpha factor, and so on and so forth there, all right? So this study, all right, tells us this, that it blocks the cytokine, the pro-inflammatory cytokine release, and therefore it can help to prevent the cytokine storm there. So this study was done in vivo, all right? In animal study, in rats there, all right? So it shows that the curcumin can actually blocks the inflammatory cytokine release and therefore reduce the prevent the cytokine storms there. And why they use this is done in using Ebola virus. Why Ebola virus? Because Ebola virus behaves like the COVID virus. All right, it basically causes a COVID, like COVID infection. It causes a cytokine storm, causing hyperinflammation there. And that's why the people who caught Ebola virus tend to die, or horribly, in fact. Okay, towards the end stage there. All right, so yeah, this is a scientific article in case some of you want to see it there. All right, so there are numerous articles, like I said, out there that shows curcumin helps to modulate the immune system and it's beneficial for autoimmune diseases. Now, the next natural immune modulator I want to talk about is a pine bark extract, not any ordinary pine bark extract, but pycnogenol. All right, pycnogenol is the original pine bark extract, right? It's been shown to be one of the most powerful antioxidants, okay, in the market today there, all right? Okay, pycnogenol is the patented form of the pine bark extract, okay? Right, and it's also found in OPC3 as well, in this OPC3 product. The pycnogenol actually has got many years of research behind, more than 40 years to be exact. It's one of the most studied natural ingredient in the world today. It's got more than 300 publications in its belt, under its belt, with more than 135 clinical studies as well too. All right, and it's got amazing properties. Like I said earlier, it's a powerful antioxidant. All right, it can help to modulate the immune system. Okay, it can help to promote healthy blood circulation, promoting healthy endothelial function, and help to promote healthy joints as well too. All right, it can also bind to collagen, the elastin, and helps to regenerate this hyaluronic acid synthesis, which helps to promote production of hyaluronic acid for healthy joints there. All right, so because of all these amazing properties, all right, being able to powerful antioxidant, powerful anti-inflammatory effect, all right, it's got wide usage, okay, all right, and it's been used for products, okay, for the benefit of cardiovascular health, skin care, for eye health, joint health, women's health, including cognitive function, all that, and so on and so forth. In fact, there are studies to show the benefits, right, for our entire body there. So the actual scientific name for pine bark extract is this, the Pinus pinusta bark extract. All right. So this is a review article. Okay. So they mentioned pycnogenol here. All right. Pycnogenol is a French Pinus pinusta bark extract there. Okay. So what it says here is this. All right. This pycnogenol has got anti-inflammatory effects and it inhibits the initiation of inflammation by preventing the release of pro-inflammatory mediators regulated by oxidative stress there. All right. So the pine bark extract actually inhibit pro-inflammatory mediators. Okay. All right. It also inhibit the release of tissue destroying enzymes like these. All right. It also inhibits, right, the various inflammatory pathway, all right, in humans as well, like the COX-1 and COX-2 inflammatory pathways as well too. All right, so pycnogenol is definitely clinically proven to reduce inflammation, to modulate our immune system there, right? So more scientific publications, all right? So pycnogenol supplementation inhibited also the 5-LOX and COX-2 inflammatory pathway. These are various inflammatory pathways, okay, which cause inflammation in our body there. Okay. All right, so again, another article saying that the pycnogenol inhibits this tumor necrosis factor. All right, okay, so basically this is inflammatory cytokine, all right, which causes this activation of NF-kappa B, which is an inflammatory switch marker, a gene there. And then this particular marker then switch on the various inflammatory pathways there, right? So pycnogenol can inhibit such activation of this inflammatory pathway. That's the gist of it there. All right. All right. So pycnogenol has been shown to actually reduce the level of CRP, the C-reactive protein. All right. What's C-reactive protein? C-reactive protein stands for is basically an inflammatory marker in our body. So when you go and do those screening tests, body screening tests, usually we do either ESR or CRP there. All right. So ESR and CRP indicates a level of inflammation in our body. The higher it is, the worse it is for you. It means more inflammation. The lower, the better, obviously. So pycnogenol can help to reduce the CRP. All right. Again, another article this time using pycnogenol found in this product called OPC3. So the individuals who took pycnogenol using OPC3 was found to have a much lower level of CRP. In fact, reduced by more than 50% there after taking the OPC3 for more than 2 months there. All right. In addition, all right, the group who took the OPC3 also benefited in terms of cardiovascular risk factors, lower blood pressure, lower cholesterol, better fasting blood sugar level, and better endothelial function as well too. But what I really want to highlight here is that the pycnogenol and OPC3 can help to reduce the inflammatory marker CRP or C-reactive protein. All right, the next natural immune modulator I want to talk about is black cumin seed oil. The scientific name is Nigella sativa, there, right? And it's found in this particular product called Thiaminol, which also contains pycnogenol, by the way. All right, so this is a review article. Okay, so basically what it says here is that extensive studies on Nigella sativa or black cumin seed, all right, extract have been carried out, right, by various researchers, and a high spectrum of its pharmacological actions have been explored, all right, which include anti-diabetic, anti-cancer, immune modulator, analgesic, antimicrobial, anti-inflammatory. Wow, there's a whole long list of it there, right? It's got antioxidant properties as well there, all right? Okay, so due to its miraculous power of healing, and sativa has got the place among the top-ranked evidence-based herbal medicines there. All right, so it's really evidence-based, backed by many research studies, right? Along with pycnogenol. That's what I'm trying to emphasize here. All right. Okay, so it's been shown to have many benefits for our body. All right, so these articles, I'm quoting this article here because it contains relevant facts. So black cumin seed oil, okay, and modulate our inflammatory response there. Okay, so how does it do so? All right, okay, through a number of ways. Well, firstly, it's an antioxidant, okay, and secondly, it's got anti-inflammatory effect there. Right, so this black cumin seed oil actually have got anti-inflammatory properties, okay, can suppress the activity of the master inflammatory regulator, what I mentioned earlier, this NF-kappa B, all right? It can inhibit the other inflammatory enzyme systems like the LOX system, the COX system as well too, there, I just talked about there, all right? Okay, because all these inflammatory enzyme systems produce those more inflammatory cytokines, right? The leukotrienes and the prostaglandins. All right. They also reduce other inflammatory compounds called the 5-HETE as well. Okay. Inhibit production and activity of the interleukins, all the other inflammatory, all right, cytokines there. Right. It also has got immune modulating effects there. All right. Able to suppress chronic inflammation and the free radicals. Right, it's got this beneficial immune responses, but right, boost the infection and cancer fighting abilities of specific cells and immune system. All right, it can also trigger appropriate activation of pro-inflammatory cytokines there. All right, when we are faced with the dangerous infections by bacteria there. All right, so therefore, note here, okay, trigger appropriate activation. All right, yes, we need pro-inflammatory cytokines, but it's got to be appropriate, all right? Not inappropriate response by these inflammatory cytokines. So supplements like black cumin seed oil can promote such appropriate response. Okay, the next one is astaxanthin there, all right? Okay. So astaxanthin, right, is basically pigment, comes from marine life, okay, like those salmon, all right, from those microalgae as well, okay, like this, in this case, the Hematopluvialis there. There's this pigment which gives the marine life its red color, all right? For example, the lobster, the krill, all right, or red color because of this reddish pigment called astaxanthin there, okay? So a number of studies have shown that it's got wide-ranging effects on the immune system modulation there, all right? Okay? Especially so for 5 human clinical trials, okay? All right, it's been demonstrated in 5 human trials, clinical trials. And one of the most impressive clinical human trial is done by this well-known researcher, Dr. Chu there, all right? And I'm going to quote you this study there. Okay, there we go. This is a study. Okay, so astaxanthin is able to reduce oxidative stress and inflammation and enhance immune response in humans there. Okay, so basically that's what the study shows there, right? But for those who want to, you can just take a snapshot and then read it. But I'm just going to show you the results of this study. So for the group that was taking astaxanthin, all right, they found that astaxanthin is able to reduce the C-reactive protein, the inflammatory marker, all right, significantly, all right. It can also increase the activity of the natural killer cells, all right. Natural killer cells are specific kinds of white blood cells, which are important for killing viruses, normal cells in our body, and also cancer cells as well too there, all right, okay. It can also help to increase both T and B cells as well too there. All right. In addition, astaxanthin is able to reduce the DNA damage biomarker as well there too. Okay, that's what this study shows essentially there. Okay? So this is very significant because it's done in humans. There. Okay, so there you go. Okay. All right, next, omega-3 fish oils there. Okay, omega-3 fish oil, everybody knows about fish oil there. Okay, what we really want are the omega-3 fatty acids, the DHA and EPA. These are the 2 most important omega-3 fatty acids there. Now, omega-3 fatty acid is a polyunsaturated fatty acid, okay, or PUFA for short there. Okay, so there are various studies which shows that omega-3 fatty acids can modulate our immune system, right? Can reduce inflammation there, all right? And it does so by controlling inflammation by affecting these processes: extravasation, phagocytic response, generation of cytokines, inflammatory mediators, and adhesion molecules. Okay, can also manipulate the functions of antigen-presenting cells and lymphocytes. Okay, a lot of medical mumbo jumbo here, but for those who are interested to know the details, this is how omega-3 fatty acids, fish oil rather, can modulate immune system there. Okay, so there you have it, folks. Okay, various natural substances which can actually moderate our immune responses. All right, but besides being beneficial for our immune system, these immune modulators can also have other great health benefits as well too there, you know, right? For instance, okay, the vitamin D. Vitamin D is absolutely crucial for our overall body health there. It actually has got benefits of cardiovascular health, okay? It promotes cardiovascular health, right? Reduce inflammation there. It's got, it can promote, lower the risk of cancer, right? Reduce the risk of autoimmune diseases, for instance, there, right? Then curcumin. All right, curcumin has been shown to be beneficial for joints as well too. It can actually, studies have shown that it helps to reduce the symptoms and the inflammation in people with inflammatory joint diseases like osteoarthritis and rheumatoid arthritis. It's been shown to benefit our brain health as well too. It helps to reduce the risk of cognitive decline, of brain inflammation there, of Alzheimer's disease as well too, right? And other inflammatory diseases. Curcumin has been shown to have anti-cancer effects as well. Then pycnogenol. Pycnogenol has been shown to have significant cardiovascular benefits there. helps in sugar control, lipid control, helps to improve cognitive function, helps to improve joint health, our skin health. It's got anti-allergic properties. It's been shown to help people with inflammatory diseases, especially those autoimmune diseases there, all right? Then we have black cumin seed oil, which I talked about. Again, so many benefits, cardiovascular benefits, brain health, joint health, anti-cancer, antimicrobial, that's right. Yeah. Black cumin seed oil has been shown to have antimicrobial benefits there, all right, including the dreaded MRSA there, right, the hospital-acquired chronic infection there. It's got anti-allergic properties as well too. It helps people with inflammatory diseases. It helps our gut as well, so on and so forth. Astaxanthin, likewise, cardiovascular benefits, eye benefits, skin benefits. Then the omega-3 fish oil, again, cardiovascular benefits, helps lipid control, like helps improve our triglyceride level, right? Improve our HDL level, all right? Brain, joint, gut health benefits, all right? Helps to promote benefits in people with inflammatory diseases, again, like rheumatoid arthritis, Crohn's disease, inflammatory bowel diseases, right? Or those people with inflammatory brain diseases like Alzheimer's there. So all these immune modulators are natural stuff, which promotes the overall well-being of our body, folks. That's why I want to emphasize here. They're not chemicals artificially manufactured, like drugs, for example, there, all right, with a whole list of potential side effects and whatnot, okay? But these are natural stuff which promotes the overall health of our body there. So when you take such ingredients, such supplements, folks, also be mindful that quality matters as well. If you ever want to take supplements, make sure it's of good quality, because not all supplements are created equal there, all right? For instance, I'll say curcumin there, all right? Curcumin is poorly absorbed on its own there, all right? You can't just take curcumin, because if you just take curcumin, all right, less than only maybe about 3% of curcumin will be absorbed there. The rest will be just flushed out in your gut through the other end there, all right? It needs to be combined with other ingredients like black pepper extract or an oil extract there, all right, to increase the bioavailability, to increase absorption there. Only then will you get maximum benefit there. And supplements like Curcumin Extreme has got high bioavailability because they look into such factors like bioavailability. So likewise for OPC3, which contains pycnogenol there, all right? This is an isotonic product, which means, all right, when you take this product on an empty stomach, the absorption, all right, will be maximized. In fact, as high as more than 95% of the isotonic solution of OPC3 will go into the gut for absorption there, all right? I can tell you, okay, more than 90% will be absorbed there, okay? Then Thiaminol itself is made out of pycnogenol, which is a gold standard of pine bark extract, and is made out of the gold standard of black seed oil, which is thymoquine, right? Okay, so they combine high quality products together to maximize the benefits. Then prime astaxanthin, all right, again, is made out of astaryl astaxanthin. Again, astaryl astaxanthin is the gold standard of astaxanthin because all the studies which shows the benefits of astaxanthin make use of astaryl astaxanthin brand there, all right? So again, omega-3 fish oil here there, okay? All right, it's this is a product of high quality because the fish oil that's in the capsules here comes from small fishes like the anchovies and sardines there, all right? These small fishes are fish off the relatively unpolluted waters off the coast of Peru, number one, and they have short lifespan. And therefore, they have less time to accumulate toxins and heavy metals from the environment. On top of that, the fish oil is further molecularly distilled to remove any possible remnant toxins and heavy metals, right? And this particular brand of omega-3 fish oil has got a high level EPA and DHA, right? Much higher than most of the products out there. I've done the comparison there myself, folks, okay? All right, one capsule contains 750 milligrams of EPA and DHA, right? Compared to 300 to 400 at the most for most of the other products there, right? And on top of that, right, this product contains vitamin E to prevent oxidation of the oil there. All right, and that's very important because when fish oil can become rancid, become oxidized, and that's bad. That's toxic for our body there, right? So this is all these products are absolutely high quality supplemental products there. All right, so look at the small details. Look at the fine print, folks. Make sure what you're getting is high quality. All right, let's talk about other immune support supplements which can be of benefit to our immune health. Okay. First, all right, about this particular product here called the Premium Immune Plus. Now, why so? Because why I would highlight this? Because it contains immune boosting ingredients like the reishi mushrooms, echinacea, American ginseng extract, the vitamin C, and the zinc there. The reishi mushrooms have been used for thousands of years. Okay, it's been known as a tonic, helps in strengthening medicine. All right, helps in healing process, helps in our connective health as well, and it's been known to lengthen lifespan. It's been shown to help to boost our immune health as well. There, okay, all right. Okay. And it helps to boost especially the white blood cell functions there. Okay, I didn't put down here because no small space. Okay, but there are studies to show that. Now, echinacea, most people are aware, right? Helps to reduce the risk of severity of respiratory infections. Right, it's been shown to have immune modulatory effect as well. Helps to reduce inflammation. It's got antioxidant effects, antiviral effects as well. American ginseng, right, has been shown to stimulate the immune system as well too. Okay, helps to also suppress inflammatory responses as well. Okay, sorry, spelling error here. All right, and vitamin C, everybody knows what it is. Then zinc as well. This is important cofactor, all right, in immune response. Okay, helps in wound healing as well too. All right, and so primary benefits helps to promote general immune health. On top of that, helps maintain our overall health, help us to have a healthy energy levels, mental clarity. So besides promoting immune health, it helps our overall health. That's again, that's what I want to emphasize. And then this particular product now. All right, it contains vitamin C and zinc, okay, and then this particular Wellmune WGP extract. Okay, so basically, it's got specific combination of immune boosting ingredients. It's been shown to help to promote healthy activity of our immune cells. Okay, helps our immune cells to be primed for response to infection. There, all right, that's what this does there. All right, so what happens that this particular product actually can help to prime immune cells to respond appropriately without overstimulating the immune system in just 48 hours. All right, studies have shown this actually there. All right, so it's because of this Wellmune extract there, and this Wellmune is actually a natural yeast beta-glucan, right? And it's been shown to help to strengthen the immune system, okay, by many clinical studies there. All right, so basically the Wellmune is first engulfed by your immune cells, and then these immune cells are the macrophages, and then these extract are then spit out, okay, and then bound to the neutrophils, or kind of white blood cells, and these white blood cells will then be primed, right, to recognize and to kill foreign pathogens there a lot more quickly there. Okay, so Wellmune can be taken on a daily basis, natural, safe, and non-GMO there. Okay, so it contains this Wellmune WGP extract. Yeah, okay, so it's been shown to help to promote healthy immune system. Again, it contains zinc, again, helps to support a healthy immune response, right? It also helps to energy production, connective function as well, and contains vitamin C too. Okay, so all right, folks, in case you've been sleeping, now's time to wake up and get a summary ready. So if you really want to have a good immune health and to maintain a good immune health, okay, to me there are a few non-negotiable things you need to take. Firstly, the multivitamins, especially the vitamin C and D there, all right? Right? Everybody knows about vitamin C, but very few people know about vitamin D. So hopefully after today's talk, everybody knows online here will know about vitamin D, how important it is for our immune health there. Then we have got the minerals there, especially selenium and zinc. Then we have antioxidants, all right? Antioxidants like the astaxanthin, the pycnogenol, curcumin, all that, which are also immune modulators. Then we also need to have good gut health as well there, all right? Because a good gut health is provides a basic foundation for our overall body health, including our immune health as well there, right? So some other supplements which can promote good gut health will be aloe vera, the probiotics, which I talked about just now too, all right? So these are important for maintenance of good immune health there, right? So what if you really want to boost your immune health further there, all right? And I would suggest you do so, especially if you're an elderly age group or you've got medical problems, especially you've got cardiovascular diseases, which indicate that you've got poor endothelial health, all right? Or if you're immunocompromised, all right? You're taking immunosuppressant drugs, okay? You've got end-stage kidney disease and all that, you might want to consider that, right? Adding supplements to boost your immune health there, such as this as a premium immune plus, the Isotonics Immune. Then also consider adding the antioxidants of the immune modulators, like the thiaminol, curcumin extreme, astaxanthin, omega-3 fish oils, yeah? All right, so remember what I said about all these immune modulators? They are great for our overall health as well too, there, not just for immune health there. All right, so what if you kena the COVID? All right, you caught the bug already, okay? Then of course, I would suggest you up the dosage of vitamins C and D, all right? In addition to the multivite supplements with selenium and zinc, all right? So then you should add the immune modulators to reduce a hyperinflammatory response, to prevent the cytokine storm that I talk about there, all right? Okay, so the cytokine storm, all right, that causes a hyperinflammatory response is not something to be sneezed at, folks, okay? All right, then what about kids? All right, so kids who, especially those who cannot be vaccinated or unvaccinated, well, we can boost their immunity by giving them multivites, okay, especially the C and D, antioxidants. We have got the OPC3, the Isotonics version, or the OPC3 chews, okay, the omega-3 fish oil. Then we've got the DNA Miracles, Isotonics Immune as well too there. So all these can be considered there, right, to boost the immune health of the little ones there. All right, folks, so really, I hope I changed your concept a little bit today about what's a healthy immune system. All right, immune system really is something that we all need, okay? It's also necessary for a healthy response to vaccination, okay? If you want the vaccination to be effective, your immune system needs to be healthy as well too there, all right? If your immune system is not well regulated, okay, it's not healthy, then vaccination can potentially trigger an abnormal response, an excessive response, causing all kinds of different side effects which other people do experience there, right? Okay, so therefore a healthy immune system, remember, needs not only to be strong but regulated. Only then can you have a functional immune system there, all right? Okay. Okay, so to achieve a healthy immune system, folks, okay, we need nutrients, and therefore supplements can be of help to boost our immunity. And I've talked about the various nutrients and supplements that can be helpful to our immune health, all right? Okay, so always remember, folks, a healthy immune system is your best defense against any infection there. In fact, I would say that the first and most important line of defense against any infection, and even cancer as well, I may add, is your immune system there, right? So we need to do what we can, all right, to have a healthy immune system, to improve the odds for ourselves, all right, especially when we're in this current pandemic there. Okay, so that's all I had to say, folks. Thank you very much for your kind attention. Okay, all right. Do we have any time to take questions? Okay, Felicia.
Yeah, I think we have a few questions. Maybe we'll just go through that quickly since we still have like probably some time left. All right. Okay. So Dr. Nyo, are you ready to get some questions answered?
Yeah, sure. But
Okay,
how do I go on to the
let me pick up the question
yeah,
for you, all right?
but yeah.
Okay, so there's a question asking about hi, other than vitamin C, are there any supplements suitable for breastfeeding moms like me?
Oh, if you're breastfeeding, then well, you can even take vitamin D. All right, you can also take the pycnogenol. Pycnogenol is safe. All right, you're breastfeeding. All right, you can also take even the Thiaminol as well too. There actually, yeah. But I would say if there's one supplement that I would pick, is definitely vitamin D. All right, at the top of the list there. All right, if you have deficient level of vitamin D, folks, okay, then your immune system will definitely not be healthy. All right. So if you don't know your vitamin D level, ideally you should have it measured, your blood vitamin D. But if you don't want to have it measured, then you got to ask yourself, are you at risk? So I mentioned earlier, who are the people at risk? Don't get enough sunshine exposure. All right. Okay, you're basically like a vampire. All right, you avoid the sun. Okay, you hardly go out when it's bright and shiny. All right, or you tend to put on some block whenever you go out. You are dressed from top, covered from top to toe. All right, carry umbrella where we go. So definitely you are not getting enough sunlight exposure. And the second thing is you're not getting enough vitamin D on diet, right? And especially so if you are not taking enough vitamin D rich foods, I mentioned, of which there are very few. Okay, so namely, all right, the cod liver oil and the cold water oily fish, right? The rest have a much lower level of vitamin D or even negligible, even zero, okay, I would say. All right, so vitamin D, top of the choice, okay, for almost all people.
Okay. All right, the next question. Can calcium, vitamin D, or ORAC be taken as a daily dosage? I have menopause. I was told that vitamin D depletes more rapid. Is this true?
Vitamin D depletes what again?
More raptant. Rampant.
Rampantly. I think the spelling wrong.
Oh, okay. So
it?
vitamin D actually repeats
I was told that
faster.
vitamin D deplete faster.
If you
as
take
I
what
recall.
calcium, you take what again? When you take calcium, you mean what depletes rampantly? Vitamin D depletes rampantly?
That's what she conclude, but
No, it doesn't. No, it does not. When you take calcium, it does not deplete the vitamin D. Vitamin D helps to improve the absorption of calcium, obviously. All right, vitamin D helps bone health as well too. All right, yeah, what I need you to remember this, folks, is that taking taking calcium with vitamin D alone may not be good enough. You need to have vitamin K2 as well, because if you're just taking purely calcium or calcium vitamin D, all right, it's associated with increased risk of calcification of soft tissues, like what? Calcifications of the breast, kidney, causing kidney stones, of the arteries as well too, all right? So on the other hand, if you add vitamin K2, all right, then the K2 can help to bring the calcium from these soft tissues and to put it into the bone, the rightful place. That's what we want there. So it's important that you take vitamin D, calcium, not only with vitamin D, but with vitamin K2 as well there, right? Does that answer the question?
Yep, thank you, Dr. Neil. So what happens if I'm allergic to berries? Can I still take OPC3?
What kind of berries? There are so many different kinds of berries. So it really depends whether or not you're allergic to any of those berries down there or not there. Yeah. So
so in general, if let's say someone is allergic to, let's say, blueberry and strawberry or these common berries, are they still okay to take OPC3?
Should be okay. There's no, as far as I know, there's no such extract of raspberries there or the strawberries. Yeah, but you also suggest you monitor. You take and then you monitor as well too. All right.
Okay. And thank you, Dr. Neo, for the very useful information. So if I have low blood pressure, can I take OPC3 or Tylenol?
Sorry, yeah. Oops, sorry, what is it again?
So if I have low blood pressure,
Low blood
so can I
pressure.
still take OPC3 or Tylenol?
Oh, okay, right. So to me, you still can, but you got to monitor. Don't take excessive amounts as well too. I'll suggest just take maybe 1 cap of OPC3 or 1 Tylenol and that's it, right? And then monitor the effects. Start from a lower dose. Don't take it out. Don't take the usual big dose at one go, all right? And then you titrate upwards to maybe say to 2 caps of OPC3 eventually, or 2 caps of Tylenol eventually. Yeah, but you take one, say 1 cap first or 1 capsule of the Tylenol first there, all right? And yeah, and monitor the effect on your blood pressure.
Okay. Can a diabetic person above 70 years old take what is that intake for people with diabetics and above 70 years old?
I don't understand it, but there's no.
Can they take such supplementation, and how much supplementation can they take? What's that intake that is recommended for people with diabetics and 70 years and above?
Well, okay. For diabetics, okay. Especially elderly range. Okay, elderly diabetic, in other words. All right, they can still take such supplements that I mentioned, okay, like the omega-3 fish oil, prime astaxanthin, the thiamine, curcumin, vitamin D as well. Yep, they can take all these there. Now, so how much you take? My recommendation is usually start at the recommended dose as listed on the product label itself there, right? Don't go and take excessive amounts, all right? And then you monitor that, okay? And you may want to consider increasing certain things only later on, all right? After you are used to the recommended dosing, all right? But only do so only if there's a real need to do, all right? So you might want to consult somebody, all right, who's got more experience in this area, all right, before you increase. But by and large, antioxidants like pycnogenol, like astaxanthin, all right, they are very safe to take at higher doses, all right. Okay, but then again, I would usually caution, don't take excessive amounts there, all right? So you got to know what you're doing really, all right? So, and don't take all at one go, all right? You should spread out the supplements throughout the day. Don't take everything, all the dosage, all the, say, two capsules of curcumin at one go, you know? No, you want to take, if you do want to increase your intake of curcumin to say 2 a day, you can take 1 in the morning, 1 in the evening, something like that, or Tylenol. Yeah, if you do happen to want to increase the dosage, you can take 1, break it up into 2 separate dosing, or even OPC3 for that matter. Don't take well, a few caps at one go, but rather break it up to say morning and evening. All right. Now, for the diabetics, okay, you got to be cautious not to take extremely high doses of isotonics products because it can potentially raise the blood sugar level quite a bit for you, all right, because you're not able to metabolize the sugar appropriately, all right, okay. But I'll say by and large, the amount of the sugars in diabetics is not significant compared to the amount of sugar and carbs that you consume in your diet there, all right, so that shouldn't be a big worry. But yeah, so I'm sorry, but I went off a bit on a tangent here. Okay. Okay, Felicia. So I hope that answers.
Okay. All right. The next question is on immune isotonic and immune plus. So whether can we take that every day or do we take either one will do? And then basically, yeah, to advise whether is isotonic immune meant to be taken daily, and how about the shopping energy immune plus as well?
Yeah, all these 2 products are actually meant to take on a regular basis there. All right, because it may, you want your immune system to be ready, to be prepared for any infection, right? For some of you, it may be too late by the time you catch infection and then to start on all these there. Your immune system may not be well prepared, may not be really boosted at all there. So if you're a high risk category, then of course, I'll always suggest that you should take on a regular basis there, right? But if you're a healthy person and all that, you want to take on an ad hoc basis, I've got no quibbles to that either, right? So it really depends on person to person there, all right? So it depends on your health, your own health, like I said, right? If you're at risk group, then my suggestion is take on a regular basis there, okay? I hope that answers the question.
Yep. Okay. Thank you, Dr. Neo. So another question here is asking about vitamin D. How much vitamin D is good enough?
Okay. Right. How much is enough? Okay. Really depends again on whether you are vitamin D deficient or not there. All right. So if you are at risk of vitamin D deficiency, and I talk about that, who are at risk, okay? Those who doesn't get enough exposure to sunlight, those who don't take enough vitamin D rich food, they're definitely at risk there. So for these people, I would definitely suggest to take a much higher dose there. How high? Well, the Institute of Health in America, okay, says that the safe upper limit take for vitamin D is 4,000 IU a day. All right, the safe upper limit for vitamin D is 4,000 IU a day. Okay, Dr. Anthony Fauci, the czar of this COVID, okay, is himself taking 4,000 IU a day. I myself, I'm taking for about 4,000 IU a day. All right. Now, if you are deficient, if you're vitamin D deficient, you should be taking more. Okay. In fact, for such people, we give as high as 10,000 IU a day for months, many months there. All right. So it'd be good to know your blood vitamin D level, actually. All right. But if you don't intend to check, then you can safely take up to 4,000 IU a day. All right.
So, Dr. Neo, is there any issue if you take too much vitamin D? Will too much vitamin D be bad for the body?
Okay. Now, people always been talking about the risk of overdose of vitamin D. To be honest, the risk of overdosing on vitamin D is actually very, very rare. So the dosage that's required for you to overdose is actually very, very high. And we are talking about, okay, something like 100,000 IU a day, okay, every day for months. All right, then you become at risk of getting suffering from overdose side effects there. All right, but who will do such thing? Which right-minded person will do such thing? All right, and those on just to clarify, only they have been on medical records, okay, showing that there are a few cases who overloaded on vitamin D. These people, they accidentally overdose. All right. One of them was taking something like a few 100,000 IU a day accidentally because it was in liquid form. So he misjudged the amount of liquid to take. And another fella took a few million IU a day, okay, for a number of months. All right. And fortunately, these two chaps did not have any serious medical complications at all there. All right. They were still in good health there, all right? So it's very rare to overdose, actually, all right? In fact, the risk of deficiency is so much more common than overdose, okay? So, and yet the overdose risk is way hyped up than the risk of deficiency of vitamin D, all right? So I think you all should not be worried about overdosing, especially if you are taking like up to 4,000 IU a day when you don't know your blood vitamin D level. It's very safe, honestly. All right. Okay. And just for information, vitamin D is a fat-soluble vitamin, and therefore it should be taken paired with fats to maximize absorption, and hence it should be taken with food after food there. All right. Okay.
All right. Okay. Thank you, Dr. Nyo, so much.
Yeah, there's a
In fact,
question here say where to purchase the supplements. I'll suggest talk to the person who brought you into this talk there. Yeah. All right. Okay.
Yeah, that's right. That's right. Okay, thank you, everyone. I think there's still questions, but I don't think we are able to answer every one of them. But perhaps you can actually be checking off with the person who invite you on some of your questions, especially if you are interested to get hold of any of this supplementation, you can check with the person who invited you, and then from there, you can take on from there. All right. All right, thank you so much for everybody's time, and especially for Dr. Nyo on a weekend like this to give us your precious 1.5 hours to go through this enjoyable session. All right, thank you, everyone. Thank you
Yeah.
for your time.
Thank you very much.
And have a great weekend. Bye.
Thank you, folks. Take care. Bye.